Senator Markey.
Thank you, Mr. Chairman. I was able to include the $15 million in the NIH budget for the research on social media's impact on children 2 years ago. So you've got the money. Please complete the study. Doctor, I'd like to begin with a straightforward question. Since you were confirmed as director, have any clinical trials been disrupted or stopped because of cuts to NIH grant funding?
There was no cuts to NIH grant funding, but there were disruptions last year in some clinical trials,
But there have been disruptions,
to some clinical trials.
okay?
But in my estimate, roughly about a dozen.
Well, HHS Secretary Robert F. Kennedy Jr. told Massachusetts Governor Healy that in October that no clinical trials had been stopped. Do you agree with that statement?
I'd have to see what Secretary Kennedy actually.
That's what he said. He said that no clinical trials had been stopped. He said that
We've
during
not,
the government?
we made sure that the clinical trials that were disrupted, we were renegotiated so that they were focused on the science and not on the political aspects of them.
Well,
And I'll just say this, there's been no patients, we've made sure that when there was the disruptions, that the investigators had the resources to make sure that the patients had continuity of care.
well, he challenged Governor Healy to show proof that these clinical trials have been stopped, and we now have the proof. In January, Governor Healy wrote to RFK Jr. with evidence backed up by a JAMA study showing that 383 clinical trials lost NIH funding between February and August of 2025, affecting more than 74,000 patients nationwide, including 18 trials affecting 13,000 patients in Massachusetts alone. So I have these letters that I'd like to submit to the record, Mr. Chairman.
Without objection?
And so this is the JAMA study for the record and the governor's letter. And at your confirmation hearing in March, you said that you would absolutely commit to supporting research that advances the health of the American people. Are you saying that none of these nearly 400 clinical trials, including 118 cancer trials, 97 infectious disease trials, 47 mental health trials, advance the health
No,
of the
Senator, I'm saying
American people?
that number, that 383 number, I read that JAMA study. I'm saying that number is based on, is not reality. Like, the reality is, at most, something like a dozen clinical trials, but the estimates we've seen actually were terminated, and primarily because they were focused on political aims, not on advancing health. The disruptions.
So you're saying the JAMA study is wrong, is that what
Yeah,
you're
I'm
saying?
saying
It's
the JAMA study
inaccurate?
It's inaccurate. It's based on an inaccurate list that didn't take into the fact that we renegotiated and restarted the trials, removing the political component of it and focus more on the health component.
So how many trials are you saying should be?
I mean, we're still working on the numbers, but the preliminary estimates I've heard is something on the order of a dozen, and they were many of them were basic and experimental studies on humans, not actually clinical trials. Whereas the 383 number, I think, is just based on an inaccurate list.
Okay, well, that's not the number that we have developed in Massachusetts, and it's not the JAMA number either, okay? So we're in a huge dispute with you on that. One of the pillars of your new priorities for NIH is to focus on training future physicians and scientists, yet everything we have seen from NIH since your confirmation contradicts this. Dr. Christopher Loker from Lowell told me how NIH grant cuts have forced his biotech company to cancel student fellowships, lay off 12 employees, and cause junior scientists to leave the profession entirely. And I can't help but agree with Dr. Loker's conclusion that, quote, under your leadership, we are witnessing the sunset of American scientific preeminence. So I request unanimous consent to submit Dr. Loker's testimony, Mr. Chairman.
Without objection.
I also heard from a researcher at Northeastern University whose lab has done mental health research for over 16 years. NIH cuts have forced her lab to lay off research staff, and they did not even have enough money to fund their doctoral students' research through graduation. Back in December, the UMass Chan Medical School Chancellor Michael Collins told you in a meeting that if NIH funding uncertainties continue, quote, we could lose a whole generation of scientists, and it will take us a couple of generations to build it back. The Chinese right now are absolutely gleeful that we are doing this to ourselves. It is an absolute historic mistake which we are making. How does cutting active research advance NIH's mission to support future biomedical researchers?
Senator, we didn't cut any funding. We spent the entire allocation that Congress gave in 2025. I think, as I said earlier, the United States remains the single best place in the country, in the world, to do biomedical research, especially for young researchers.
Okay, thank you, Mr. Chairman.